So good morning, everyone, and welcome. Good morning. My name is Altaf Seshanwala, President and CEO of Mackenzie Health, and today marks a truly momentous occasion for the community of Vaughan and York Region as we celebrate the official groundbreaking and start of construction for the new Mackenzie Vaughan Hospital. And I thought many of you thought this day would never come. It's actually happening. This long-awaited milestone marks several years and countless hours of planning and designing a new state-of-the-art hospital that will also be the first smart hospital in Canada. And there's a number of people here, many dignitaries. I want to try to take a moment to thank many of you for coming, and I will not get all of you sort of acknowledged. There's just so many of you. But first and foremost, the Honourable Stephen Del Duca, MPP of Vaughan and Minister of Transportation. Thank you, Stephen. John Fraser, Parliamentary Secretary to the Minister of Health and Long-Term Care and MPP for Ottawa South. John. Our wonderful Mayor, Honourable Mauricio Bevilacqua. And all other elected officials. There's so many of you, and I really do acknowledge and thank you all for coming. So thank you, thank you. Members of Mackenzie Health Foundation, Volunteer Association boards, and the Mackenzie Vaughan Hospital Campaign Cabinet. And many of our community healthcare partners and hospital colleagues from across the GTA, thank you for coming. And a special shout out to our staff, physicians, and volunteers who are watching this live at Mackenzie Richmond Hill Hospital via webcast. So thank you as well. Mackenzie Health has built a strong foundation of healthcare delivery across Southwest York Region. The Mackenzie Richmond Hill Hospital are numerous community-based locations across Vaughan, Richmond Hill, and Simcoe County. And with a dedicated team of physicians, nurses, staff, volunteers, and with the leadership of our board and senior staff, the new Mackenzie Vaughan Hospital will be built upon a solid foundation, and it will add much-needed capacity and increase access to healthcare for the growing communities of Vaughan and York Region. It will bring a two-hospital model of care that will be a seamless experience for patients and families with integrated care and a single leadership structure. Since the Mackenzie Vaughan Hospital was approved in 2011, we have marked a number of important project milestones. In 2013, we received $49 million for the planning and design of the new hospital. And a year later, in July of 2014, Mackenzie Health and the City of Vaughan celebrated the start of the early work to prepare the hospital land for future development. In April of 2015, Mackenzie Health and the City of Vaughan signed a 99-year ground lease to secure 40 acres for the immediate hospital build, as well as additional 10 acres for future expansion. And later that year, in June of 2015, we released the request for proposals. And just last week, in the wee hours of the morning, right, Angelo? We reached commercial and financial close with the successful proponent, Plenary Health, who will design, build, finance, and maintain the new Mackenzie Vaughan Hospital, allowing us finally to move ahead with the start of construction. And while the journey of building a new hospital is never an easy one, we will remember today's celebration as a recognition of this community's belief that this new hospital will become a reality. This was made possible by the generous support and investments from our provincial, regional, and municipal governments, as well as many community donors. So for that, we thank you. And now, it is my pleasure to introduce a longtime supporter of Mackenzie Vaughan Hospital, of Mackenzie Health, a friend, someone who has called in the wee hours of the morning to drive this project forward and to continue to keep it moving forward. The Minister of Transportation and MPP for Vaughan, the Honourable Stephen Del Duca. Stephen.
Well, good morning. Hold all my calls, please. Good morning, everyone. I'm absolutely thrilled to be here with all of you. What an incredible looking audience. So many smiles on the faces of all the guests who are here today, of course. And it is really and truly a glorious day for Vaughan and a glorious day for York Region. So I wanted to start off by saying thank you to all of you for being here with us. Of course, I want to say thank you to Altaf, not only for serving as our Master of Ceremonies today and for introducing me, but of course for the incredible leadership that he has shown through many years working on this project. Someone who I've come to know quite well, and someone who is not only, as he's fond of saying, and rightly so, not only our hospital president and CEO, but someone who feels this in a very compelling way because he is also a resident of Vaughan. So Altaf, thank you to you for all of the work that you've done throughout many, many years. I know Altaf mentioned that there are many elected officials here. I want to take just a quick moment to acknowledge my colleagues from the legislature, my York Region colleagues from the legislature, Dr. Reza Maridi, who is the MPP for Richmond Hill and the Minister of Research and Innovation. Reza Maridi. And Dr. Helena Jasic, who is the MPP for Oak Ridges Markham and the Minister of Community and Social Services. Thank you very much for being here today. We're very blessed in York Region because there are five of us who are MPPs in the legislature on the governing side. All five of us are cabinet ministers, which is I think a record right across the province of Ontario. And I can tell you on this particular project, both Helena and Reza have been champions alongside a wide variety of the caucus members that we have. So I wanted to say personally to Helena and Reza, thank you so much for your support for the Vaughan Hospital project. Absolutely, please. Yeah, absolutely. We're also, of course, joined by Deb Schulte and Francesco Sorbera. Deb is the Member of Parliament for King Vaughan, the riding that we're standing in right now, and Francesco is the Member of Parliament from Vaughan Woodbridge, my home riding just on the other side of the highway. And I have to say, Deb and Francesco would ordinarily be in Ottawa, but they made specific plans to be here because they understand, having worked on this through a number of months and years, they understand how important it is to be here. I just hope that the federal government doesn't fall today because you're both here. So this is an absolutely glorious day. I know at the end of my remarks, my formal responsibility today is to introduce my very good friend, John Fraser. John is the MPP for Ottawa South. He is also the parliamentary assistant, as Altaf mentioned, to the Minister of Health and Long-Term Care. I don't want to steal any of John's punchlines because he and I chatted right before we started this morning. But John is a dear friend, someone I've known for quite some time, someone who has come to know and love Vaughan over the last number of months, and I'll let him elaborate on some of that when he gets to the podium. But I just wanted to say, John, thank you so much for being here and for being such a great friend and supporter of this community as well. Thank you very much. Now, there are actually formal remarks that I guess folks want me to deliver, but today is a day on which Greg's already shaken his head. He's already shaken his head. I'm not going to stick to the formal remarks because today is such a day of incredible celebration for this community, for Vaughan, for all of York Region, and really, it's an immense feeling of gratitude that I have. I said to Angela when I walked into the tent this morning, someone tell me I'm not asleep, right? We're not dreaming here this morning. This is really actually happening, and of course it is. And there are so many people that deserve such extraordinary thanks. And it's always a little bit dangerous to start down that path of thanking people, but there are just a few that I want to highlight before I leave the podium today. And so, of course, I want to start with Greg Sorbera. Greg is not only a friend and a mentor of mine, not only someone who served our community for so many years as the Member of Provincial Parliament in so many different versions of this riding, starting back in 1985 and all the way up until 2012. Greg is the person who laid the foundation for what we are here today to deal with, for the groundbreaking itself, for the hospital, for that notion that our community, because of its incredible growth over the last number of years, was in need of hospital care locally. And so I wanted to say to Greg, not only for starting this process, but for never wavering in his support. And frankly, here we are just about 4 years since he retired from the legislature, and he's still involved. He's still got his sleeves rolled up, got his head down, and he's out there working with so many others to raise the money that we will need from the local community share. Greg Cervera, thank you so much for everything you've done on this hospital. And I know the mayor was acknowledged by Altaf, but I have to say to Mayor Bevilacqua, someone who I've known, again, for many, many years, someone who is always very focused on delivering positive outcomes for our community here in Vaughan, someone who showed extraordinary leadership through some of those twists and turns over the last few years in particular, and demonstrated the kind of leadership that's needed in order to make projects like this a reality. So to Mayor Bevilacqua, thank you so much for being a wonderful partner on this. I really could spend all day at the podium thanking people, because really this is the product. This project, this groundbreaking in the hospital that we're building, is the product of so many people, from the earliest warriors. I see Lou Greenbaum sitting right here in the front row. The earliest warriors who have multiple levels of scars dealing with all the circumstances that we had here. But to know, I mean, so many people who are here, from Infrastructure Ontario to, of course, the current board of the hospital, previous boards, previous councils, previous mayors. This list goes on. It's endless. Not only Premier Kathleen Wynne, former Premier Mackenzie, not only the current Minister of Health, Eric Hoskins, but I think now, Greg, we've gone through 3 or 4 Ministers of Health working on this project, from Smitherman to Kaplan to Matthews to Hoskins, and here we are today. Just before I finish up and formally introduce John, I wanted to say a couple of things. First of all, we're obviously here to celebrate an exceptional milestone for the community, the official groundbreaking. And one of the things that I'd be remiss if I didn't point out, yes, this is very much a collective responsibility and something that we have worked so hard to deliver in a very collaborative fashion. The provincial contribution to this hospital, as I've been told to say by the folks at Infrastructure Ontario and elsewhere, and this is important for us to note, it's a provincial contribution of up to $1.3 billion to deliver the Vaughan Hospital, which I think is great news and very well deserved. But sometimes when we participate in events like this, and I feel this from a transportation perspective when I'm in various parts of Ontario, and we're talking about transportation infrastructure, or in this case, hospital infrastructure, the numbers are huge, the numbers are big, and that's extremely important for us to acknowledge. But putting aside all of the numbers, putting aside everything else that we talk about as it relates to these projects, I'm also, as you know, not only the local MPP, many of you know, I'm the father of 2 young children, 2 girls. One girl, Talia, who's about to turn 9 in just a couple of weeks, and our younger daughter, Grace, who's 5, going on 16. And I just wanted to spend a quick moment to tell you what this actually means for me when I think of them, and I think of the thousands of other young boys and girls who live in this community. I think of my own daughter. By the way, we drove along Major Mac just a few weeks ago, Your Worship, and I want to tell you, I mean, I've often, over the years, in those moments where things, you know, in public life, sometimes things feel like a little overwhelming. You're not sure, you know, how it's going. Helena, you know that feeling, right? You and I talk about that sometimes. Well, this actual property, this site, knowing that our hospital would be built here, is something that I often looked upon very fondly, because it's something that helps keep you going when you're in public life. So there we were just a couple of weeks ago, driving along Major Mac, going this way towards our house, and I looked out the window and I said, sort of in a grand voice to my 2 daughters who were in the back seat, do you know what we're going to be building right over there? Pointed out the window. My 9-year-old, almost 9-year-old, she's heard this story many, many times. She said, yeah, Dad, yeah, we know. It's going to be the hospital. And our 5-year-old looked out the other window and said, ooh, Wonderland. That's a true story. That's an absolutely true story. But my point in saying that is to know, for me to know, for my wife and I to know. My wife's here, by the way. Utilia is right there at the back of the room. For me to know, for us to know that our daughters, should they choose to continue to live in Vaughan, and I sincerely hope they do because I'm close to my kids, I want them to stay here. It's a wonderful community. To know that they will have, I'll call it hospital needs, excellent hospital services here close to home. If they live here, if they want to start their families here, they'll be able to actually give birth here in our community, something that you can't do inside a hospital. You've never been able to do inside of a hospital. When I think of my parents who moved us up here to Vaughan about 30 years ago, as they age, and as so many other people across our community do age, people who have made contributions throughout their entire lives to the city, to the region, to the province, and to the country, to know that they will have that opportunity to receive, again, excellent hospital care closer to home, to know that nearly 300 or over 300,000 people who live here in our community will no longer necessarily be required to be what I call hospital commuters, healthcare commuters, is something that is incredibly encouraging, incredibly heartwarming and rewarding for me to know. And I know also that none of it would have been possible, none of it all would have been possible if it wasn't for the fact that so many women and men through so many years worked so hard on this particular project. And I believe these kinds of projects are emblematic of what can be accomplished when people are willing to work together, when you're willing to put everything else aside, focus on producing results, focus on giving people those positive outcomes that they certainly deserve and expect. So I am absolutely thrilled to be here with all of you today. I'm looking forward to the official groundbreaking. I'm sorry I've gone on a little bit longer than maybe I should have, but this is a very important day. It's a very poignant day. And I just, again, wanted to say to you and to everyone else across our community, thank you for your patience, thank you for your resolve, and thank you for working with me and others to relentlessly pursue making this dream of ours a reality. So thank you very much for that. And now my formal responsibility is to invite my very good friend, again, John Fraser, the MPP for Ottawa South, Parliamentary Assistant to the Minister of Health and Long-Term Care, to come to the podium and to deliver some remarks on behalf of the provincial government. Thanks very much.
Thank you, Stephen. It's a real pleasure to be here today for this major milestone for Mackenzie Vaughan Hospital. Now, the Minister, Eric Hoskins, couldn't be here today. I'm his parliamentary assistant, and he very much would like to have been here. But one of the things that you learn when you work in health is it's a $52 billion complex organization. And as my colleagues, my friends, the ministers who are here know, often your job is managing the interruptions and the things that happen on a day-to-day basis that prevent you from doing the things that you would really like to be able to do. So it's really great to be here to celebrate this project and the start of construction. And as Stephen referred to a bit earlier, I was in Vaughan in August at the hospice to announce our support of the hospice and the great work that they're doing there. And so now I'm here to talk about a great new hospital, and I'm thinking, like, I want Stephen Del Duca to be my MPP. But I'll just have to do with the guy we have right now. And it's always good to check at home when you're an elected member. It's a good gut check at home to make sure things are going okay. I won't go too far into that, but they usually bring you down when you need to be brought down, and I'm sure that we all know that. So, but what I'd really like, what it really is all about is, I realize that Stephen and my colleagues, Reza and Elena, you come from a great community. I was here for the hospice. The support is absolutely incredible. I can see the support here for this project. It's absolutely incredible. And what I really want to say right now is to the community and to the staff and the providers and the volunteers and the caregivers and all those people who do so much for the quality care that people need, the compassionate care that people need. I just want to say thank you for caring for the people that we care for most. And that's what this project is all about. And it's really giving expression to the work that you do. So thank you very much. So once the construction of the Mackenzie Vaughan Hospice is complete, it will help build on the incredible work being done by all the healthcare partners here in the region. So we announced in 2015 our Patients First Action Plan for Healthcare. In that plan, we made a commitment to the people of Ontario that we are going to transform healthcare and put patients at the center of that. And one of the key objectives of that plan is to provide Ontarians with faster access to the right care closer to home. And the Mackenzie Vaughan Hospital is going to help us deliver on the commitment to the people of this community. By putting shovels in the ground today, we're making a concrete step towards a technologically advanced, patient-focused healthcare for the people of Vaughan. And when you take a look at the pictures and and you look at how we're constructing new hospitals and the amount of light that's in the hospitals and private rooms, it really is going to transform healthcare. One of the things, and a lot of us can remember the old ward rooms in hospitals and semi-privates. It's really, and I have 95-year-old in-laws who've been kind of in and out of hospital. My mom was there. So when you're in a room with 2 or 3 other people, it's really sometimes very hard for people coming in to visit and people's privacy. And that's, one of the things in healthcare, it's critical to make sure that we provide quality to people to ensure that they get better. So, I do want to say one thing that, because I know there's a lot of people in this room who worked very long on this project, that it's the effort of a community. But as elected members, we give expression to the needs and the desires of our community. And often, we don't get you're not there, you're not sitting in that seat, that place where you're representing people. You're no longer elected, and the project that you worked on for such a long time arrives. And it could be a road, it could be a community center, but when it's something like a hospital, it's a really incredible, impactful thing. And I wanted to say, I'm really glad that Greg Cerber is here, because I know that he, along with a number of other people, but he very much was at the core and the center of this inside the provincial government for a long time. And he's somebody who I have a lot of respect for, and I'm really glad that he's here today. So congratulations. Thank you, Greg, for everything that you've done, not just this. And congratulations, and thank you to you all. And I look forward to seeing the hospital when it's finished. And now it's my honor to introduce Mayor Bevilacqua and ask him to come up and say a few words. Thank you.
Thank you. Thank you, John. And you can come to Vaughan and make announcements anytime you want. Steve, you were worried about delivering a long speech. Like for $1.3 billion, I'll sit here for a month. So I want to thank you so much for being here today. What a wonderful day. Today really is special for many reasons. I look at Altaf. Okay, it's not just for Altaf, but Altaf, this journey has been an interesting one. I think sometimes, you get to know people in the journey when you work on a project, and you begin to appreciate and get to know their true character. When I talk about Altaf Station Well, at first I thought, this guy's a real pain. I mean, you agree with me. Thank you, Altaf. And then I found out you really were. No, but then you recognize that really our energies were actually quite in sync. Quite in sync because we were fighting so hard for the same cause, challenging each other. Angelo, you were around sometimes, right? You look younger, though. That's. And what is wonderful about this experience, what has been wonderful about this journey, has been that early on, and Steve, you probably remember this, right? There were some people that were doubting whether this project would ever happen. And what today really teaches us all is that when you're rooted in hope and optimism and faith in a project that is really rooted in those values that speak to the higher frequencies of human existence, great things can be achieved. Today we're here because those values superseded anything else. All of us, and I say every single person in this room, was devoted and dedicated to the mission of bringing healthcare to this great city of ours. Through this process, I also got to know another person even better, and that is Stephen Del Duca. I just want to tell you, Steve, that it took me 2 minutes to get from Jane and Rutherford to this place. So you're a great Minister of Transportation. But I do want to say something about Steve Del Duca. You know, Steve is in public service for all the right reasons. I think he truly believes in what he's doing. He cares deeply. He's, I think, a man of great integrity who's going to do exceptionally well in politics and public life because his values are the right ones. We have the great. I have the great privilege of being one of Steve's friend and talking about the needs of this community. And it's always about putting people first. And this hospital was ultimately about putting people first. About, you know, it was about the cancer patient and the expectant mother. And it was about, you know, our ailing elderly people who have given so much to our country and to our city. It was about all those things. And when we got through, and I remember, Altaf, through all the legalese of contracts and all that, what made this project possible was that we forgot about the legalese, we forgot about those contracts, and we focused on the people that require care in this city, and that's why today happened. And for that, Altaf, and to the entire team, I want to express my warmest and sincerest gratitude for all that you have done. You have shown exceptional leadership. You have shown a great sense of humanity. You have driven by a caring and compassionate spirit, which manifests itself in many, many, many ways here in our city. You know, just a few weeks ago, and we had a wonderful announcement by the Vic Dezan family, $10 million towards this great cause. And it's really not the size of the contribution, but it's the size of the heart of the people here in the city of Vaughan that are willing to contribute, to say, I want to belong to this great project. And to me, it warms my heart. And prior to that, it was Magna. And I understand, Greg, we're going to be doing a function pretty soon at City Hall that you will be intimately involved. And then you have a guy who's the chancellor of York University and, you know, former Minister of Finance and all that, giving of himself to this cause. And so you see what's happening in this community? Everybody's got some blessings. Everybody has some gifts, John, and we put it on the table. And everybody works together. Everybody wants to achieve those ends, to speak to those beautiful goals of building a city, of building a community. And this place, this hospital, this city will be here a lot longer than we collectively will be here. And that's how we think now. What I've seen and what I've witnessed, and by the way, today, 6 years ago to today, I was elected mayor of the city along with council 6 years ago. To imagine that 6 years later, we would finally have our hospital warms my heart and brings a lot of joy to me and to the entire city, that I'm sure is going to welcome this announcement in ways that they will embrace the spirit of that which truly is the manifestation of the true spirit of our city, which is the spirit of generosity. Before I leave this podium, and I will, because Steve is doing the calculations, right? He said, I came here with $1.3 billion and I spoke for 10 minutes. How do you get to speak for 12? But I do, before I leave, I want to, first of all, if I may, introduce my colleagues that are here. Marinaya Frady, Gino Rosati, Mario Ferri, thought I saw Michael DiBiase's here as well, Tony Carella, Sandra Young-Rocco, Rosanna De Francesco, Alan Sheffman, and that's it. That's right. We didn't get that extra seat at Regional Council. I forgot. And before I leave, I just want to say to Steve, thank you. Altaf, thank you. To the province of Ontario, please express to the minister and also the premier our warmest and sincerest gratitude. Look, this government has been exceptionally good to us. Do you know that the 427 extension is going to be built 10 years ahead of schedule? Thank you. Thank you so much, Steve. Your hospice announcement, We're going to have the subway opening up. Greg, you were a big part of that. The subway's opening up next year, 1 year from now. And, yeah, please, go ahead. And also, before I leave, Daniel Katsopoulos is here. He's our new city manager. He's been with us for 2 months, and he's still smiling, which is really good. I bring up his name. Sorry? Vito Spadafora is here from Richmond Hill. So how does it feel to be in paradise for a few hours? Richmond Hill, Vaughan, you know. Okay, we're okay, we're good. I mentioned Daniel Katsopoulos, I'll tell you why, because all this work here, with cooperation, of course, in Altaf and the entire team of Mackenzie Health, the roads, the sewers, everything has been done, worked really hard. The city has worked really, really hard. So I'll convey on your behalf the great appreciation you have. And I'm going to leave on a final note. When announcements like this are made, what happens is there are people that get on stage and they get to speak and they get to represent levels of government, organizations, and board of directors. Anthony, thank you so much for your work as well. And then there are people that perhaps are not even under this tent. At this moment, my mind and my thoughts are with those people who care deeply about this hospital, who give the best of whatever they have within their hearts, within their spirits, within their minds, and truly believe in this project, and perhaps they're never mentioned. And to all of them, and there are probably 325,000 here in this city, who really are going to give something. How it manifests itself, we don't know. But our thoughts should be also with them. Thank you very much.
No, I was just thought you might want to come again. Would you like to come up again? That's good. That's good. So I just kind of got dazed as Mauricio was up here. Sorry, Mauricio. So it is my pleasure now to provide greetings on behalf of Wayne Emerson. He really wanted to be here, but he could not. And as any big project, the region is a huge contributor to this effort. They are contributing hundreds of millions of dollars towards the local share plan. So I have a small message here from Wayne. On behalf of Regional Council and the residents of York Region, we'd like to congratulate Mackenzie Health, the Government of Ontario, and all the partners involved in the development of the new and innovative Mackenzie Vaughan Hospital. This groundbreaking ceremony is a tremendous sign of the progress for a much-anticipated healthcare center. This state-of-the-art hospital will also provide a tremendous boost to the regional economy. Mackenzie Health expects that over 1,000 new construction jobs will be created in the building of the new Mackenzie Vaughan Hospital, and that over 1,800 staff and 100 new physicians will be required when it opens its doors. The new Mackenzie Vaughan Hospital will be a welcome addition to our local municipalities and our region. I look forward to the official opening in 2020. Signed, Chairman Wayne Emerson. Now, we have the benefit, and I think Mauricio spoke to this, in the end, our business is about people caring for people. And we have a great advocate of Mackenzie Health. It's my pleasure to introduce Julia Supa, a Mackenzie Health patient. Julia.
Thank you, Altaf. Good morning, Ministers Del Duca, Fraser, Moridi, Jasic, Stoltz, and Sorbara. Mayor Bevilacqua, local councillors, and honored guests. Thank you very much for having me here. I'm so pleased and honored to be participating in this momentous occasion, breaking ground at Mackenzie Vaughan Hospital. More than 30 years ago, my parents too chose Vaughan as a place to raise their family. Today, my husband and I continue that tradition, raising our 2 daughters in this beautiful city. The city has grown tremendously in that time. I've grown up within the community and have celebrated its strengths and assets. One thing our city has desperately needed was a hospital, and here we are today. 4.5 years ago, I was pregnant with our first daughter, Isabel, a textbook pregnancy, until one day I got very sick. No one expects or plans in their first pregnancy to have an emergency delivery 10 weeks before their due date. It definitely wasn't in my family's plan, along with a hospital stay for myself and baby. 9 weeks for baby, 62 days to be exact. When the transfer from a level 3 hospital to a level 2 hospital became available, we were hesitantly optimistic to be moved to Mackenzie Richmond Hill, then York Central Hospital. Of course, any new parents of a teeny baby were obviously going to have their slew of worries, but we were relieved to have a hospital much closer to home. It meant shorter drives to the NICU, more time with our baby, and more opportunity to cuddle, bond, and ask questions. And ask questions we did. Hundreds of them. We were at Isabel's cot side morning through night, my husband and I taking shifts, while immediate family members came to visit a few nights every week. We developed a beautiful rapport with the nurses and doctors. It sounds cliche, but they became part of our family too, and played a significant role in Isabel's early development. I have many memories and a whole variety of emotions when I think back to the time we spent in the NICU. But overall, it's a feeling of warmth and community. It is so very important to have a local hospital where residents can feel at home, ask questions, and be guided with outstanding medical care and support. Believe it or not, we cried the day we went home. Tears of joy and excitement, no doubt, but bittersweet tears while bidding farewell to the staff in the NICU. And it's for this reason, among many others, that I lend my support and belief in the new Mackenzie Vaughan Hospital. I'm so thrilled that future mothers and fathers will have a state-of-the-art women and child program and an NICU so close to home. My husband and I are very proud of our daughter Isabel, who despite her early start, impresses us beyond words every single day. And our 2-year-old daughter, Madeline, who is as lovable as they come. We may not have been here without the support and care of our local hospitals. A hospital is much more than a building. It is a team, it is a collaboration, an opportunity to unite people. It's a place where people need to feel safe and taken care of. Mackenzie Vaughan will be a vital part of our city, and I can't wait to see it come together. I'd now like to welcome Chair of Mackenzie Health Foundation Campaign Cabinet, Greg Sorbara.
That was so well done. Thank you ever so much. My job is to speak just a little bit longer than both Stephen and the mayor, which I'm accustomed to doing. But I am sensitive to all of those in the back of this shelter who are standing and whose feet are just freezing by now. So I'm going to make it very quick. This is, as others have said, an incredibly wonderful and important day. Stephen will remember 15 years ago, 2001, a group of people in Vaughan, Stephen at that time was the Wonder Kid, but a group of people in Vaughan started to discuss the urgent need for a hospital in a municipality, Your Worship, that even then was growing as rapidly as anywhere in Canada. That date sticks in my mind because it reminds me of the thousands and thousands of people who, in one way or another, can take credit for the fact that we start construction with the breaking of ground today. At the ministry, within the municipality, architects, engineers, literally a huge workforce, all focusing on one goal. And led, in this instance, by Altaf Station Walla. I am in awe of you. I don't want to go on. I'm not going to go on too long with this, Altaf, but, you know, typically, now I'm joining my family in the construction business, you're building a project like this, you hire someone to take it on and make it happen. In this instance, we asked Altaf Station Walla to build a new hospital at the same time as he is leading one of the most overburdened, no, the most overburdened hospital in the entire province, if not the country. And that is a triumph and a tribute that few others in this country can attest to. So, Altaf, on behalf of all of us, thank you. My job is to act as chair of the campaign cabinet, a wonderful group of men and women who are taking time out from their real everyday lives to make sure that we successfully raise $250 million in this community as our community contribution to the hospital. And I want to publicly thank all of them and remind them that we are meeting Ingrid on Friday at 1. Don't you dare miss it. I am so grateful for the energy and the time that is put in by this campaign cabinet. It's not easy knocking on a door and saying, I'm here to ask you for $2 or $5 or $10 or $15 million out of your personal bank account. But that's the work that we do, and we have a dedication that is unparalleled in any campaign, and this is the largest community hospital campaign in the country. We've met with great success. Maurizio mentioned the Magna contribution of $10 million. When you come to this hospital in an emergency situation, you will come to the Magna Emergency. And he mentioned as well Vic Dezen, one of the great citizens of this region and this country, whose family has committed $10 million. And when you come to the hospital and you're not at the emergency, you'll be coming into the Vic Dezen Family Welcome Center. I'm thrilled that these two places will bear the names of two huge, important, and successful companies in our community. Those are large gifts, and we are going to be pursuing a number of additional large gifts. The fact is that Vaughan and York Region is one of the wealthiest communities in all the country, and that's as a result of the hard work of the men and women that call this place home. But we intend, as the campaign goes from its quiet stage to its public stage, to drive into every single driveway in this community. Because the goodwill of this community assures me that virtually every resident of this community and every business will want to have their name and their contribution associated with this hospital. So we have a lot of work to do, and any of you that want me to come by over the next couple of days and pick up a check, just call me. I'm in the area. I'm not out in the county. I'll be here and I'll do that. We have a lot to celebrate today, and we have a lot of work to do from today onward. I just want to express a note of gratitude to the hundreds of men and women, professionals, who will ply their trade pouring concrete and stringing wires and putting in ventilation systems and laying bricks and doing all the things that our professional construction crews do. May they work safely and speedily. And 3 years down the road, we'll all be here together to cut a ribbon. And that's going to be a great day as well. But the greatest days, the really great days, will be the day after we cut that ribbon, when the people of Vaughan and Southern York Region and Northern City of Toronto will be able to avail themselves of the state-of-the-art hospital in the entire country. I've said before, and I'll say again, that when this hospital opens, given the designs that Altaf has determined and insisted be part of the hospital, healthcare professionals from all over Canada and North America will come to see what we're doing and how we did it, so they can replicate that in their own communities. And that will be a very proud day for all of us indeed. So thank you all for being here. Sorry for the cold feet. Our hearts are warm, and it's a great day. Thank you all very much. And now I'm going to ask Anthony Ianni to come up and say a few words. He is the chair of the board of Mackenzie Health. Anthony?
Thank you, Greg, and good morning. It's my pleasure to bring greetings on behalf of the Mackenzie Health Board of Directors. Our common pledge that we all share with one another and with the staff, physicians, and volunteers is our commitment to creating access to world-class care for the people of our communities. Key to realization of that goal is the building of the new Mackenzie Vaughan Hospital. As we look to the future of healthcare in our community, we are not simply adding a new building. Rather, we are planning for the future delivery of healthcare within the walls of our hospital and beyond. Mackenzie Vaughan Hospital will be the first hospital in Canada to feature a fully integrated smart technology. The smart hospital vision, applied both to the new Vaughan Hospital as well as the existing Mackenzie Richmond Hill Hospital, will create a truly connected patient experience inside and out of the hospital setting, utilizing digital communications and the Internet of Healthcare Things to provide quality healthcare delivered through the eyes of the patient. As you've heard before, during construction, Mackenzie Vaughan Hospital will create 1,000 construction jobs. While upon completion, the new hospital will include approximately 350 new beds, a state-of-the-art emergency department, modern surgical services and operating rooms, advanced imaging, and specialized ambulatory clinics and intensive care beds. The new smart hospital will create over 1,800 full-time equivalent positions once completed and will attract and retain the very best staff, physicians, and volunteers in the province. Thanks to the support and investments made by the province of Ontario, the regional municipality of York, and the city of Vaughan, the Mackenzie Vaughan Hospital is becoming a reality. And we'd also like to thank the Mackenzie Health Board of Directors and the senior leadership team led by Altaf for their hard work in meeting this milestone. In recognition of these contributions, it's my honor today to present the province of Ontario, the regional municipality of York, and the city of Vaughan, as well as the Mackenzie Health Board of Directors and senior leadership teams, with 2 commemorative plaques that will be installed and permanently displayed in the new Mackenzie Vaughan Hospital once completed. Thank you to each and every one of you. We look forward to your continued support as we work to build the new Mackenzie Vaughan Hospital for the people of our community and to realize Mackenzie Health's vision to create world-class health care right here in South York region. I'd now like to ask Altaf to come up and give us a preview of the new hospital. Altaf?
So I'm going to wrap this up, and it's amazing with all these politicians that I have the actual last word. But I do have to appreciate all of the efforts, and there are many politicians that played key roles, and I think you've heard about the thank yous. But Reza, your support has been instrumental. Helena, your support has been instrumental. Obviously, our elected officials at Vaughan, the mayor and council, our esteemed MPP of Vaughan. It took a real effort, and it was not that difficult when you think about it, when these individuals came together for a common cause and a common purpose. We could have had our parochial views of this is my riding or this is my area, but I think they put that behind them and said we need more health care for this region. And I think that's what brings us here today. Those local issues were irrelevant to the bigger need for greater access to health care, and that's why we're here today. We look forward to continuing to work with all of you as we move closer to the opening of the new Mackenzie Vaughan Hospital. And I myself, I think it was said that I'm a resident of Vaughan. I live in Woodbridge. I've lived there for almost 13 years now, and I've worked in a variety of different hospitals while I've lived there. William Osler, Mount Sinai, and obviously now Mackenzie Health. Never really understood where I would go for health care living in Vaughan. Many choices, but nothing local. And I think that is the greatest benefit. We will finally be able to say we have a hospital for our city, the city of Vaughan. Now you see many of the images around you, and I have to say that the process to come to these final designs has been quite spectacular. This hospital has been designed first and foremost from the patient's perspective. It will be the first smart hospital in Canada, and that will really dramatically change how patients interface with the healthcare system and how our providers work in a very advanced technology environment. We will have systems and medical devices that can speak to one another, that will improve the information exchange between patients and the providers and improve the experience for patients and families. It will mean quicker access to the medical records and really integrated communication and care amongst the hospital, but more importantly with community providers, because we know that we are just one part of the journey, and the integration of care with the community is just as critical. As you can see from the preliminary renderings on either side of me, this is a world-class facility. Greg spoke to that. People from around the world will come to visit this incredible thing that we have worked so hard together to create. It will be 1.2 million square feet, very, very large, and have lots of green space. It will have a clear and simple design, and it will be filled with a lot of natural light. It will have the flexibility to help us evolve with new best practices. We know healthcare changes, and we need that flexibility in design, and ultimately it will improve the patient experience. As we move ever closer to our two-hospital model of care, which includes the Mackenzie Richmond Hill Hospital and the new Mackenzie Vaughan Hospital, we look forward to continuing to provide exceptional care. I think Greg pointed out how challenging it is for our staff at the Richmond Hill site, day in, day out, to provide care in a facility that just can't meet the needs of this growing community. Patients and staff are stressed every single day to find ways to access care, yet despite the challenging space and despite the challenging access, we provide exemplary care every single day. And the reason we can do that is we have the most exceptional staff in this province to provide great care to this community. So more than anything else, I thank the staff and our patients for their support, and soon enough we will have greater access and greater care in this growing community. So thank you for joining us today. Thank you for joining us today to mark this very special occasion. Now I will ask the speakers as well as the Mackenzie Health Board and senior staff to come up on stage for some photos. And following that, we will ask the speakers to join us on the actual grounds of the future Mackenzie Vaughan Hospital for the official groundbreaking. Again, we invite you to join us outside or stay in the tent. You can watch on the screens around us, have some refreshments, and again, thank you for celebrating with us today.